In October this year, the World Health Organization raised a medical alert asking countries to be on the lookout for four India manufactured syrups, which it had potentially linked to the deaths of at least 70 children in the Gambia. And earlier this week, India's Drug Controller General wrote to the WHO saying that, perhaps this conclusion was premature as the WHO hasn't been able to so far provide any data like the clinical picture of the children, what drugs they were prescribed, what were the symptoms that brought them to the hospital, and detailed investigations on whether the patient samples contained any contaminants and things like that. The data that was sought by India hasn't been provided by WHO or the Gambia, the Drug Controller General said in the letter. And they have also independently tested the control samples from the same batch that was sent to the Gambia that were stored by the company as a quality control purpose, and found that there were no excess quantity of contaminants present in these two syrups. The two contaminants that were potentially linked to the deaths in the Gambia, diethylene glycol and ethylene glycol, were tested for and not found in these cough syrups. As a matter of precaution, the Drug Controller General also tested the propylene glycol and glycerine, which are used as solvents in these syrups, to test them for these contaminants, and found that there was nothing above the permissible limits present in the raw material as well. So after this, they wrote to the WHO and said perhaps the conclusion was premature, and they said that because of this alert, it had actually harmed the image of the Indian pharmaceutical industry abroad.